Miffy, thanks for coming today.
Pleasure.
Now you're a physiotherapist.
Mm-hmm.
So today we'd like to talk about how our emotions mirror in our health. What has your experience been with your patients?
I treat a lot of patients, a lot of adult patients, male and female. Emotions will always play a role in how someone recovers. Negative emotion tends to slow down recovery. Positive emotion tends to speed up recovery. The more positive we can keep a patient, of course, the more positive their recovery and the faster. Without a doubt, there's a strong influence from the emotional side in recovery.
And as a woman, how do you find patients like being treated by another woman? Like, does it make a difference?
I think that's a very personal question. I don't think it's specifically women like being treated by women, men like being treated by men. It's very much a personality thing, much like you meet people who have more male friends than female friends. It tends to work the same with physiotherapy. It very much has more to do with, do I feel comfortable with the physio? Do I feel like they understand my problem? In terms of being a female, I think that's where we benefit, where a female can often eke out more information from a patient so that they feel like they're understood more. They can open up, they can talk not only about the pain or the dysfunction, they can talk about what might be causing the dysfunction or why they're having a hard time at the moment. And that's certainly a benefit being a female.
And how does your intuition help with the work that you do each day?
Intuition as a medical professional or as a physio is a taboo subject.
Yep.
The medical industry now wants to lean toward evidence-based medicine. I can prove I do something, I can prove I make a change. Intuition is a very unresearched topic. It's almost a bit of sort of voodoo type belief. But at the same time, I use my intuition every day. I feel like good therapists, good medical professionals will always use intuition. They mix it with experience. So you read a person because you've encountered that many people before, but also because you understand where they're coming from, and then you bring in your intuition that doesn't quite fit, that fits, I think I can get more information from a patient. But I use it every day, and it can be a positive and a negative. If I use it too soon with a patient, I tend to feel a little bit like I've judged a patient.
Yeah.
So I often wait till I have a better understanding of the patient before I'll decide they're not telling me everything I need to know there. I need to ask more questions. Intuition will also guide you as to why a patient might be getting better or why a patient may not be getting better. And that's when you need to start looking further into it to say, we need to find out what other psychosocial aspects are involved with this patient. And I think as a female, particularly with other females, I can see a little bit more there and understand why something's not improving or if there's something else to ask about.
So it's kind of like experience really contributes to your intuition.
Absolutely.
At the end of the day.
Absolutely.
What role does compassion play with treating patients? Because obviously patients are coming in pain.
When we talk about compassion, I like to sort of separate it out first into empathy and sympathy. Empathy is something a physio must have, which is understanding what's wrong with a patient, understanding how they feel about that problem, understanding what they want from treatment. And it's still being able to look at a patient objectively. Sympathy, however, is more bringing into the subjective side and being more emotional with a patient, agreeing with a patient. The problem with sympathy is that I bring my emotions into the treatment, and that makes me lose objectiveness, but also it can influence the patient's emotions, which isn't necessarily a good thing. When we then talk about compassion, which is helping along with the empathy and the sympathy, if you're compassionate along with empathy, I think that's fantastic because you're objectively helping the patient. You're seeing the situation clearly and you're then objectively helping them. When it's the opposite, which is compassion with not the opposite, but the other side, which would be compassion with sympathy, you lose some of that objectiveness and you might end up treating the wrong problem and something that you're not comfortable with. You might decide that I need to help this person emotionally first. As a physio, I feel I need to identify the emotions, but it's not my position to help with the emotions. That's where I need to be aware that it might be time to refer on to someone else or to seek other help.
Yeah.
But I will always use compassion with empathy.
Yeah. I know myself as a patient, when I meet a professional or a healthcare professional and there's a good feeling, I'm in a position to heal. But also in my life, I've had healthcare professionals that have been so cold, I don't even want to go back. So it's really, like, it's interesting, there's that fine line between connecting to assist healing
Yes.
and then getting too involved.
Yes. I think also it depends on the profession itself. As a physio, we spend time with the patient, which is what I love about the profession. We get to know the patient, which means that I can use my intuition more because I understand a patient. I think if you're in more of an impersonal role as a medical professional, maybe you're a surgeon or an anaesthetist, the personal contact isn't quite as important because you're there to do a small job, you don't spend a lot of time with them. But at the same time, they tend to follow the facts more than they follow their intuition.
Yeah.
But my job takes in a big chunk of intuition to allow a patient to heal, to encourage a patient to heal.
And looking at the industry as a whole, so doctors, nurses, everyone in the healthcare profession, how do you personally feel, as a patient as well, by having women working in that field?
I think it's important to have men and women working in all fields.
Yeah.
First of all, I feel I need to say that. Women have an ability to make people feel more comfortable. Particularly as a female, they make me feel more comfortable. So, because I think they understand me. I feel I can open up to them. I think women, when you do open up, women open up back.
Yeah.
That connection is very important in terms of making me feel comfortable and healing. Then from a physio side of it, I like a patient to feel comfortable. If they don't feel comfortable in my room, I can't feel comfortable with them and I can't learn from them.
Yeah.
So the more connection we have, the better. I think as a female physio, I'm quite comfortable making a connection with someone. And I think that's a benefit of being female.
Yeah.
For sure.
And of course everyone's different, but it's still
Absolutely.
nice to, I think, for people to find their match
Yes.
in their healthcare.
Yeah. And I'm not a fan of shopping around, but I'm a fan of shopping around if you're not comfortable.
Yeah.
So, and certainly even as a physio, there are patients I don't necessarily like treating because we have no connection. I don't have the luxury of asking them to shop around.
Yeah.
But I'm always surprised when a patient comes back who I feel I've had no connection with.
Yeah.
And then I work at it.
Yeah.
And you tend to find there actually was a connection in the first place. Perhaps you just missed it. Perhaps when I've said before that I don't use intuition early on because I don't like to judge early on, perhaps that judgment I should have made and I would have made the connection in the first place.
Excellent. Thank you very much.
Pleasure. I find fear a little scary to begin with. I think identifying your fears, talking about your fears is the best way to deal with your fears. I don't think we get enough of it. I don't think we identify love as love. I think we identify it as friendliness. I think we start to need to identify it as love. Courage is silent. I think a lot of us are very courageous, but perhaps we don't yet accept it or believe it. Thoughts on feelings, I love them. I think we need to express them more to make us more aware of them and to make other people more aware of our feelings.